Now also, this could be a lot longer, just so you all know. Like there's a lot more that you could examine on the cardiovascular. But once again, we've tried to streamline it so you're only recording, or you're only doing like the most important steps of the cardiovascular assessment. An example of that in class, we're going to talk about the carotid arteries, palpating, auscultating. You don't actually have to do that in the exam. So just so you know, when you get to lecture next week and you're like, we didn't practice that in lab, it's just because we're not going to include that on the check off. Okay? All right, move all this stuff out of the way so I don't trip and hurt myself.
And they asked a question about the head to toe. I said, that's why we do these spot checks in an individual, and then when we get to head to toe, it's more, you know, not as in detail. So.
Yeah.
And I remind them the picture on the back will help them. I like that picture better than the one because it was confusing earlier. That's what we went over. So, okay.
All right, so Hi, my name's Courtney. I'm going to be your nurse today. I'm going to do an assessment on your heart. Is that okay?
Yes.
Okay. Do you have any concerns today that you'd like to talk about?
No, thank you.
Say no. Okay, thank you.
I did.
That is not required that you ask that. All right, I'm not going to have her scoot all the way to the back of the bed, and to be honest, if you all want to have your partner sit just like that, that's perfectly fine, okay? All right, so inspection is first. This first step, what you are doing, now this is going to be difficult because we are all fully clothed, okay? We're not getting in gowns or do anything like that. It's going to be very difficult for me to see her point of maximal impulse. Where would you look for that? Okay, so the anatomic fifth intercostal space of left midclavicular line. Okay, so I am looking. I'm going to say that I visualize this. Superman have X-ray vision. Okay, I'm seeing pulsation. Okay, it doesn't look to be excessive in nature. I'm not seeing any visible like heaves or lifts. I don't think we've talked about that in class just yet. We'll get there. So you're looking to see if you see any visible heaves or lifts in the chest. All right. Overall, I'm looking at skin. She appears pink. I'm not seeing any cyanosis. She doesn't seem extremely pale. I can look at her nail beds. Those look pink. If she had her legs exposed and her toenails out, I would look at the nail beds as well. Somebody was joking the other day. They're like, my nail beds are purple. I'm like that every time I am in my office. I like start typing and I can't feel my fingers because they're purple. Okay, so you're looking for color. They're pink. Fingernails, toenails are pink. We're good with that. I'm looking for hair distribution. Usually you're looking more so on the legs. We have not gotten to this in our lecture yet, so we will talk about arterial insufficiency, venous insufficiency, and the changes that can cause when you have either arterial or venous insufficiency, what that would look like. I feel like on females it's harder to tell versus, because women shave their legs typically. Now, if you had, let's say Angie, if I was noticing, maybe she had let her hair grow out on her legs and she hadn't shaved, and I'm noticing some thinning in a certain part, I might ask her, how long has it been like this? Have you noticed that it's thinning out? Or maybe she has patches of hair that are missing. That could clue us in that there might be an arterial insufficiency. Okay, we'll talk more about that in lab. So you're just looking at hair distribution. Much more noticeable in men, I feel like, because typically some men don't have a lot of hair on their lower extremities. But if they have a lot more hair on their lower extremities and you're starting to see a pattern where it's gone, or you're seeing like no hair, because I've seen that, like absolutely not a sign of a hair on the lower leg, you could ask, is this normal for you? Have you ever had hair on your lower extremities? You might want to ask, because some men shave their legs, especially if they're athletes, swimmers, that kind of thing. So never assume that they have arterial insufficiency. So you just want to ask. All right, for palpation, you guys know how to assess for capillary refill. So I'm going to assess her capillary refill. You do not need to pinch every single finger. I see this in the head to toe, and they're going from finger to finger. It's not necessary. So you can just assess maybe one or two. I'm going to do each hand. And her capillary refill is less than 3 seconds. And then I would come down to her feet. I would check her capillary refill on her toes. Okay, capillary refill is less than 3 seconds, hopefully, under there. I'm gonna palpate her radial pulses. Now, before we edited this sheet, every single pulse was on there. And I'm like, no, we do not have time for that. Okay, so that's why we practiced locating earlier. And in practice, realistically, you're not gonna palpate every single pulse on your patient. It can be assumed that if Angie has radial pulses, that she's got brachial pulses, right? Make sense?
Mm-hmm.
It can be assumed that if she's got pedal pulses, she's got popliteal pulses, and she's got femoral pulses, okay? You all will learn in med-surg and critical care when it would be a critical behavior for you to go to a more central pulse, like the carotid or like the femoral pulse, if we're worried about, I don't know, sepsis, if we're worried about just hypovolemia. Those would be instances where you would really need to go and assess central pulses and peripheral pulses. But for now, we're just focusing on peripheral, okay? So radial pulses, I'm gonna assess bilaterally, so this is part of the skill. You'll need to demonstrate that you're assessing both at the same time, okay? Okay, those are both palpable. Rhythm feels regular. Amplitude +2 or 2 plus. And then I am going to count. Interesting. What is that? Okay. Her pulse rate is 80 beats per minute, regular rhythm. They are symmetrical, and I would say a 2 plus amplitude for both radial pulses. Let's see. We're gonna come down to the feet. You can do this however you want to.
That was a question they had.
Yeah, you can do this however you want to. However, with the head to toe, what we see most people do, and this is how I do it because it is a true head to toe. I will do everything here first, so I'll look at the skin color, I'll do the cap refill, I'll check the pulses, and then I'll come down to the lower extremities and I'll do the same thing. So I'm looking at the skin color, I'm checking the pulses on the feet, I'm checking the cap refill. So you'll kind of get into this rhythm of just working your way from head to toe. Does that make sense? But if you are like, you know what, I'm just gonna do cap refill on the hands and the toes. I'm gonna do the pulses, that's okay for right now. But what we're looking for eventually in that head to toe is that you are creating a very fluid assessment, and you're not what I call herky-jerky. You're not up here doing the pupils, and now I'm down here looking at the pedal pulses, and now I'm inspecting your hair, and now I'm checking your deep tenon reflexes, and now I'm gonna listen to your lungs. That's a disaster, okay? And the best way to organize yourself is from the head to the toe, all right? Okay, so I'm palpating dorsalis pedis, which would be on the top.
Should we take one?
Yeah. Oh, I'm getting Charlie horse.
You okay?
Oh,
Those hurt.
Yeah.
You'll feel better for my happy socks. This chance on the word today.
Okay, I'm not gonna squat down like that. We're gonna do this.
There you go.
Thank you. Oh, I can actually feel them through the socks. All right. So they're equal bilaterally, regular rhythm, say a +2 amplitude. I'm gonna go for the dorsalis pedis.
And she's kind of right behind my ankle bone, guys, just to give you an idea.
Okay, say regular rhythm. So symmetrical +2 amplitude, or 2 plus, however you want to say it. You don't need to count rate on your pedal pulses. You're also looking for edema. Overall, you're looking for edema, but most people who have heart problems will demonstrate what we call dependent edema, which is lower body. Care if I lift your?
I don't care.
I don't care. I mean, I don't think I
Shaved
want my
about 4 days ago.
Actually shaved yesterday. All right, so I'm looking. I don't think I see. Remember, I saw edema last
Yes,
time I
you did.
assessed you. I was like, Angie, your legs are edematous. All right, at least I'll just
John made me climb stairs earlier, I guess.
Give it that squeeze.
Pull these down. Okay. I don't actually see any visible edema. If you did see edema, and we'll talk about this in class, you can palpate and press down to see if it's what we call pitting edema. Okay, and we're going to talk more about pitting edema in our lecture next week. So you're pressing down to see if there's an indentation or if the skin kind of stays indented, and we'll talk about how to score that in lecture.
I was also telling them during something earlier that sometimes you have to push through the edema to get to the
Yeah, because you're like, oh, nothing's happening, but if you put enough pressure, it will eventually. I call it the Michelin Man. I don't know if you know who the Michelin Man is.
Yes.
That's what my babies look like when they were babies. But you push really hard, and they do. It's just rolls of fluid. Okay. All right. So next we're going to do the heart sounds, which we've already talked about earlier today. So you're going to make your way through the ape to man. I think we left Herb's Point off of here. Yes, I did.
I wear sports bra, you know.
Okay. So you don't have to do Herb's Point. We're going to do aortic, pulmonic, tricuspid, and mitral. Okay. All right. So take a listen here. Sorry. There we go. So for the checkoff, you're going to want to just verbalize out loud, I'm auscultating the aortic valve area, so we know what you're doing. Pulmonic valve. All right, I'm going to go down just a little bit. First, go down the fourth intercostal space to the tricuspid. No, I'm obviously not gonna be able to get it under there. So, if you all are assessing, which most of you are females, if you are assessing a female, whether it's here or in the hospital, most of them will have gowns on without a bra on, or if they have some sort of bra on. Regardless, what you should do is you should always ask permission to displace the breast. You can always ask the patient if they can lift their breast out of the way so you can listen. Or if it's a situation where they are unable to follow commands, that sort of situation. The technique is to use the back side of your hand or your arm to gently displace the breast tissue, okay? Should never be this, okay? That's inappropriate. So this side, okay? Somebody's laughing, but I have to say it because it happened, right? There's always a rule because someone did it. All right. All right, Angie, can you lift your breast up for me? Thank you. All right, so, and you can see this is a situation where her lying back just a little bit, gravity would assist with kind of raising and getting the breast tissue out of the way, because truly her fifth intercostal space is behind her breast tissue, which there's no physical way I can get there, just so you all know. So what you will do is you will go under the breast tissue and up as far as you can to get to that fifth intercostal space. Okay. All right. Come on this side. I'll go up under your bra if I can. It's hard with the shirt on, just so you all know. You can actually hear something. All right, so I'm hearing the mitral valve. This is also the location for the point of maximal impulse. So the fifth intercostal space, left midclavicular line. When you are here, you're gonna count for a full minute to get your apical rate, okay? That is gonna be the longest minute of your life, okay? So you can tell your patient, I'm gonna be counting for a full minute. Hear your bowel sounds too. heart rate was 76 beats per minute, regular rhythm. At all of the locations, S1 and S2 were heard. No extraneous sounds, no S3, no S4, and no murmurs or rubs heard. Okay. All right, did I miss anything? I will tell you, if I were demonstrating the way that I would do this on a real person, I would actually start with inspection, do the pulses, do my cap refill, listen to the heart, and then I would save the feet and the legs for the end. That's just how I perform it. Everybody develops their own kind of flow. Okay. Yeah.
What about, when did you alternate the diaphragm and the bell?
I do not do that in my own practice.
Okay.
And I'm not gonna require that you demonstrate that in the checkoff. I personally don't think it's realistic. I don't think anybody does it. Now, when did we talk about if you need to use the bell?
For low tones, peds.
Right, so if you're like, I feel like I heard a murmur, what you might do is twist this around, use your bell to see if you could help identify if it was, an S3, an S4, or a murmur. And it says, I think on your sheet it says when appropriate, is what it says.
Okay.
And some of the mannequins, as we talked about today, you gotta remember that some of them are older. So the reason I had you use, some of you guys use your bell was because of where obviously the location was, and so you guys could actually hear it. That's why we use the bell today for a lot of it over that way, and this guy here. So just so you guys know that as well. So yes, your diaphragm is what you'll use good 90% of the time. So
Yeah.
unless you're in a special unit or something.
And I already told you, we use the bell a lot in pediatrics.
Yeah.
I know herb point isn't on this exam, but what are we, like, freshman, I don't know if I guess we should probably talk about it in class, but I forgot, but like, when you're listening to herb point, what are we listening to?
So Erb's Point is just another location for the pulmonic valve.
Okay.
So it's just another location where you can also hear the pulmonic valve.
Alright.
So it's kind of like the same as,
And it's just one intercostal space down from the second, when you, or from the first one, so.
so it's 2, you're on the right side,
Yes.
it's
Yeah, sorry.
2, 2. If you're doing Erb's Point, it's the 3rd intercostal space. Tricuspid is the 4th intercostal space, and then the mitral is the 5th intercostal space, left midclavicular line.
And notice that she didn't palpate each rib and count.
Yeah.
You get so used to, because some of you were asking earlier, like, how far down, I can't quite feel it. I mean, she knows approximately the neighborhood, and then she kind of adjusts to find the right spot within there. That's why it's important to verbalize, so